July is National Minority Mental Health Awareness Month, and when it comes to health care, racial and ethnic minorities often suffer disproportionately because of a lack of access to care and the stigma.
2 on your side's Liz Lewin was able to speak to a local provider who says that's especially true when it comes to mental health.
When the least of us aren't being supported, the whole of us cannot be supported.
When it comes to conversations about mental health, it's hard to ignore stigma and inequities that separate communities of color from others as it relates to treatment and care. According to the American Psychiatric Association, barriers include lack of insurance and diverse mental health providers, along with language barriers, distrust, and inadequate support.
When things happen within our community, it's not necessarily looked at as a public health crisis either.
Data shows mental health diagnoses are overwhelmingly overlooked, underdiagnosed, or misdiagnosed amongst minorities. Back in 2019, the U.S. Department of Health and Human Services reported suicide was the second leading cause of death for African Americans ages 15 to 24. That's why Giselle Stokes, the founder of the Mindful Institute, LLC, and a longtime mental health practitioner, says recognizing national minority mental health awareness is so important.
When you look at people of color and their mental health specifically, I think that you have to think differently.
Stokes says there needs to be more communal empathy towards historical and present-day lived experiences in minority communities and the impact that they have on their mental health.
When things happen within our community, it's not necessarily looked at as a public health crisis. Mental health for people of color is connected to past traumas, it's connected to racism, it's connected to a variety of socioeconomic status issues.
Another challenge, equal representation.
We are so limited in our resources. I am the only person, a woman of color, in many of the mindful activities that happen in the region.
Stokes says change is hard, but possible with an open heart and an open mind.
We are Black, we are brown, we are white, right? But we are human, right? Our race is the human race, and we are 99.9% more alike than different.
Giselle also tells me as it relates to mental health, perception is often reality. So to you at home, if you're struggling right now, try creating a new habit of positive self-affirmations and repeat them every day. She also suggests journaling and art as tools to express yourself. And please remember that your feelings are valid. In the Information Center, Liz Lewin, Channel 2 News.